The first POCUS exam involves the gastric ultrasound. Place your probe in the middle of the stomach in the sagittal plane. In this view, you see the liver, the antrum of the stomach, and the rectus abdominis muscle. You can also see the superior mesenteric artery and the pancreas. Here is a more detailed view of the stomach. You can see the rectus abdominis muscle, the liver, the antrum of the stomach, the pancreas, the superior mesenteric artery, the aorta, and the diaphragm. In this view, you will appreciate that the antrum of the stomach is small and looks like a bullseye. This indicates that the stomach is empty. After appreciating the small bullseye appearance in the supine position, you must also turn the patient on the right lateral decubitus side to verify it is also small, contracted, and looks like a bullseye. If you see consistent imaging in both positions, you can officially clarify that the stomach is empty. Ultrasound imaging should not substitute ASA guidelines and should simply be used as a tool to assess the appearance of the stomach. All ultrasound exams done by POCUS by nurse anesthetists are binomial, answering yes and no questions only and not diagnosing. In this image, we notice that the stomach is full. It does not have a bullseye appearance. It is large and oblong shaped. In this instance, we would simply say the stomach is full and adjust our anesthetic plan accordingly. To check for pleural sliding, place your probe in the sagittal view over the anterior chest wall. The pleura in green is sliding, indicating that your lungs are intact. If it is not sliding, you may have a pneumothorax. The airway exam can be performed in the transverse view and also the sagittal view. In the sagittal view, you'll see the thyroid cartilage, the cricoid cartilage, along with the tracheal rings. Scan cephalad and caudad in the transverse view to orient yourself. In the most caudad position of the airway, you'll notice the trachea that is air-filled and hypoechoic with the tracheal rings. As you travel cephalad, you'll note the thyroid gland. Continue scanning cephalad to note the cricoid cartilage, the cricothyroid membrane, the thyroid cartilage with the vocal cord muscles. The ultrasound imaging of the heart can be performed in several different ways. We are going to focus on parasternal long axis and parasternal short axis views. The parasternal long axis view is completed by putting your probe around the fourth intercostal space on the left side of the chest and pointing your indicator towards the right shoulder. In this view, you can see the right ventricle, left atrium, aortic valve, aorta, and mitral valve. The parasternal short axis view is achieved by rotating your probe 90 degrees clockwise from your parasternal long axis view so that the indicator is now pointing towards the patient's left shoulder. In this view, you can see the left ventricle, right ventricle, papillary muscles, and sometimes the mitral valve. This view is optimal for quickly assessing the pumping action of the left ventricle to identify any deficits. You are looking to answer yes or no if there is fluid around the heart. This is an attempted parasternal long axis view that looks more apical. It would have been better if I was around the fourth intercostal space. Here is the short axis view. The right upper quadrant exam should be mid-axillary. In this view, you will notice the liver, Morrison's pouch, and the diaphragm. Sometimes you can also see the right kidney. The goal of this view is to identify if there is any fluid yes or no, around Morrison's pouch, evidenced by an anechoic structure. For the left upper quadrant, anchor your probe in the posterior axillary line around the 8th intercostal space. You'll appreciate the spleen, left kidney, diaphragm, and the lung. The goal of this POCUS exam on the left side is to identify any free fluid between the spleen and the left kidney, which will be anechoic. Last, we have the ultrasound of the bladder and transverse view. This ultrasound helps you answer the question if the bladder is full, yes or no.